is both a gallbladder and cardiac ultrasound. We'll start with the gallbladder first. I reviewed this a couple times and I don't see any clear stones. However, it does appear the gallbladder to be a little bit thick. If you freeze it here, this seems thicker than normal. Maybe that's some pericholecystic fluid. Hard to tell, especially with patients who are cirrhotic. The wall can look falsely thick, and you could maybe see some fluid that's not due to the gallbladder, but more due to the cirrhosis. Again, here's another clip, kind of the same thing. To me, the wall looks a little bit thick, but non-specific, and since I don't see any clear stones, hard to make a definitive diagnosis that this is cholecystitis based on these ultrasound clips. The cardiac ultrasound is limited, but I am concerned for possible free fluid. Now, when you look at this, you wonder, is this fat pad? Is it an effusion? But when you look behind it, there seems to be a linear finding that may illustrate a pericardial effusion. What I would have done is I would have increased the depth a little bit, maybe set to 24 centimeters, so you can find the descending aorta. And if you see that hypoechoic rim that goes around the heart, that'd be more concerning for a pericardial effusion. To me, I would say it's indeterminate, but it does have findings that are concerning for it. A couple also tips is that the probe seems to move a lot. When you're looking at the heart, it's best to keep it still to try and really focus on the movement and then to see if there is indeed an effusion or not. Sometimes it helps to have the patient move on their left lateral decubitus side. That brings the heart closer to your probe, and you can get better views in the parasternal long, parasternal short, and apical 4. Here, because of the liver in view, I think this is probably a subxiphoid view, and that is the indication to actually keep the patient on their back and not to lay them on their side. So, hope that helps. A couple take-home points. Let me know if you have any questions. Thanks.